It's my feel-good breakfast show.
Yes, it is a terrific Tuesday. Thanks so much for starting the day off with us. Now, the thyroid is a very little gland that plays a very vital and important role to your health. They call it the control panel of your body. And this week, we observe International Thyroid Awareness Week. And joining us this morning for our health segment is endocrinologist Dr. Zane Stevens from the Cape Institute of Endocrinology. And he's here to help us better understand its function and to clear up some misconceptions. Great to have you here, Dr. Stevens.
Morning, thank you for having me.
Good to have you here indeed. Now, it is World Thyroid Week, and we are going to be running up to World Thyroid Day, which is this Friday, I believe.
Correct, yeah.
But can we maybe just start it off, contextualize what exactly is the thyroid all about and where does it sit in our bodies?
So it's a very good question because a lot of people, until they actually have a disease of the thyroid, never have actually heard of what the gland is.
100%.
So it's often described as a butterfly-shaped gland that sits here in the base of our neck.
Yeah.
And the thyroid gland really controls what we refer to as our metabolism. So in other words, how we burn and use energy. So it really has far-reaching effects kind of on all organ systems of the body. And diseases of it would be as a result of kind of an over or an underproduction of thyroid hormones, or sometimes because of structural changes of the gland. Unfortunately, we see young people presenting with thyroid cancers or nodules of the thyroid, which may or may not also affect the hormone levels themselves.
Yeah.
So really an important gland.
Yeah.
As we now move into the 10th year of
Correct,
International
correct.
Thyroid Awareness Week, what is the importance of this week?
So 10 years ago, the sort of two big bodies in the world, the American Thyroid and the European Thyroid Association, because of this lack of awareness about the diseases of the thyroid, it's actually said that 60% of people with thyroid disease are undiagnosed. They decided to create this World Thyroid Day and sort of the week around that, really to just bring about awareness of thyroid diseases.
I wanted to also ask, when you talked about thyroid diseases and cancers as one of them that you mentioned, what are some of the causes of thyroid diseases, and are these things that are preventable?
So it depends whether you're talking about sort of structural diseases or hormone over and underproduction diseases. So
Yes.
those are more common, and by far the most common causes are autoimmune conditions.
Oh.
So to a certain extent these are genetically predisposed, but there's some kind of environmental trigger which then sets them off. Often we don't know what that is. So to a large extent, unfortunately, not avoidable, but very, very treatable. And I think that's what this week is really all about.
You know what, I'm so happy that we have these weeks because I think a lot of us are not very knowledgeable on these things. When we come back, I want to chat to you about an overactive thyroid, an underactive thyroid, and how exactly you know that there's a problem in your body, and of course, that the thyroid is actually the person, or not the person, because it's not a person, but it's actually the thing that is responsible for that. Exactly.
Yeah.
So when we come back, we're going to chat further to Dr. Zane Stevens. It is World Thyroid Week leading up to World Thyroid Day on Friday, and we're chatting all about the symptoms and, of course, that overactive or underactive thyroid after this.
It's my feel-good breakfast show.
All right, we're back again with Dr. Zane Stevens, endocrinologist, specialist in the field of hormone study, and we are talking about thyroid health, with this being International Thyroid Awareness Week. And we've had lots of interesting conversations during the break.
I wanted to know, many years ago, I had a friend who had an underactive thyroid, and with that came fatigue, weight gain. Like, she didn't know how to handle it. She was always tired. It was really, really bad. What is the difference between an underactive thyroid and an overactive thyroid? Which one is more dangerous, and how does one attack it? How do you deal with it?
So both of them are dangerous if they're not managed appropriately. An underactive thyroid is probably more common than an overactive thyroid.
Yeah.
And those symptoms that your friend were sort of experiencing are kind of very typical. So severe fatigue, a degree of weight gain. I'm always cautious about it because a lot of people would like to blame an underactive thyroid for sort of severe weight gain.
Yeah.
And a lot of that is lifestyle. But if it's not appropriately managed, it is going to be difficult for you to lose weight through kind of lifestyle measures of diet and exercise.
Yeah.
So, but probably the more dangerous one in the acute setting is somebody with an overactive thyroid.
Wow.
Because your thyroid hormones, we said, kind of control many systems of the body, your heart being one of them.
Yeah.
And so in excess, people can present to us with sort of really rapid heartbeats. They can even present to us with heart failure.
Oh, wow.
And so that can sometimes be actually a crisis, which needs sort of urgent intervention. But in the long term, both of them obviously have to be treated. An underactive thyroid left untreated also has impact on our cholesterol profile. which predisposes to heart disease then in a different way. So both of them are dangerous if untreated.
Yeah. And like you said, those are symptoms rather that present when you have a disease that affects the function of the thyroid. So when you have a disease that affects the structure of the thyroid, what symptoms are you looking for there?
So those are actually more difficult because in most of those patients, the hormone levels are entirely normal. So unless the patient kind of sees that their thyroid is enlarged, or it's often family members or people, colleagues at work will say, you know, your neck looks bigger than it was a couple of months ago. Or sometimes kind of feeling the neck, somebody might actually feel a little nodule in their neck, which prompts them to go and see their doctor, and they would then usually end up having an ultrasound. And we can, on ultrasound, see nodules of the thyroid that worry us. And then the next step would be to do what we call a fine needle aspiration, where we put a very fine needle into that nodule, draw off some cells, and kind of get a better idea of exactly what's happening there. But those are often difficult to diagnose because they don't have profound symptoms.
I'm trying to feel my thyroid. Can you feel your thyroid?
Where are we feeling, like, first and foremost?
So we usually stand behind the patient when we examine the thyroid, because the thyroid sits really low down in your neck, sort of below your Adam's apple. It's where it would sit. So if your thyroid is of normal size, often you can just feel the tip of it, sort of here in the sternal notch. But when it becomes enlarged, then it obviously moves upwards and we can feel it. And one of the tricks that we teach medical students always is that it moves up when you swallow. So if you're sitting and you're watching somebody and something below their Adam's apple sort of moves up when they swallow, that potentially is their thyroid.
Trying to
Are
swallow.
you feeling it?
For a moment, I just couldn't swallow on command.
You need a sip of water, always.
Okay, so when we come back, I want to talk about the relationship or the link between thyroid function and iodine intake. Iodine?
Iodine.
That's the one. We'll be right back.
It's my feel-good breakfast show.
Welcome back. This is your Feel Good Breakfast Show. On this Tuesday, we're taking a look at International Thyroid Awareness Week, which we are in right now. Dr. Zane Stevens, endocrinologist, joins us to discuss thyroid health. And earlier on during the break, we were asking, when is a good time to get tested or to test the health of your thyroid?
So I think obviously if you've got any of the symptoms that we spoke about earlier, either of an under or an overactive thyroid, it's a simple test. It's a blood test which you can do through your general practitioner and we'll know. In terms of screening, it's quite difficult actually. Nowhere in the world are there clear guidelines as to whether or not we should just be screening the population in general, even though these diseases are actually not uncommon. But certainly if you come from a family history of patients with thyroid disease or people with thyroid disease or other autoimmune conditions like type 1 diabetes, one would consider screening somebody. And in young women who are struggling with fertility, struggling to fall pregnant, that would be another group certainly that we would be wanting to test because there are some implications on that front.
We've actually got a caller on the line, Estelle from Bloemfontein. Good morning, Estelle. What is your question or comment for Dr. Zane Stevens?
Yes, hi, good morning, team. I would like to know from the doctor. I adore spicy and very hot food. Can it pose as a potential danger to my throat and the thyroid? I know it causes ulcers.
All right, thank you very much for that question there, Estelle. I think we understand the question. So an
good question.
overindulgence in spicy or hot food, could that affect your thyroid?
Fortunately not. So if she enjoys it, she can go ahead with the exception of the sort of reflux symptoms she mentioned. So it's a common question actually about whether or not diet plays a very big role.
Yeah.
And I suppose overall one would say no. Unless you're living in a place that is extremely iodine deficient, then sort of iodine in food would be helpful potentially for your thyroid. But in general, no, diet really doesn't play a very big role.
Okay, thank you so much, Estelle, for that question. Talking about iodine, what is the link between your thyroid's functioning and iodine intake?
So the thyroid requires iodine to produce thyroid hormones. So any iodine that you take in food and seafood or whatever the case is would all go into the thyroid and be used to produce thyroid hormone. And because of that, you know, different places in the world have different policies in terms of iodization of salt and so on, like we do in South Africa. And the prevalence of thyroid diseases are quite intimately linked to what the background sort of iodine sufficiency is. So places where there's very little iodine, we tend to see more sort of what we call endemic goiters, so low functioning thyroids and enlarged thyroids.
Is there truth to the statement that cutting gluten out of your diet is beneficial for your thyroid?
So that's really sort of popular at the moment. Where the link comes from is So as we said, an underactive thyroid is an autoimmune condition, the most common of which is Hashimoto's. And where you've got one autoimmune condition, you are, compared to other people, slightly more at risk of developing other autoimmune conditions, of which celiac disease, which is a true gluten intolerance, is one of those.
Okay.
But unless you have proven celiac disease, there isn't really definitive evidence at the moment to suggest that a gluten-free diet alters the course of your thyroid condition. So there's a lot of work looking at that at the moment, but I would say at the moment there isn't sort of good evidence for it.
Fantastic. Well, I hope to keep you here just for a second longer, Doctor. It's been very, very insightful chatting to you. And of course, you can give us a call on 021-430-9881 as we continue our medical chat with Dr. Zane Stevens.
It's my feel-good breakfast show.
Well, we're back with Dr. Zane Stevens, and we're chatting about thyroid diseases, thyroid functioning. And I think, there's been a lot of questions about whether or not living a healthier lifestyle can improve one's thyroid or fix thyroid problems. Is there any truth to it, or is there just so much more to it than that?
So probably the more important thing is just to use your medication appropriately. That's often a big problem. The problem is that we often don't know what those triggers are that start off the disease. So, you're born perhaps with this genetic predisposition to an autoimmune condition, but we don't know whether a stressful life event or an infection triggers the disease ultimately. So certainly, following a healthy lifestyle may prevent that. But I think once the disease has been diagnosed, currently there's not a lot of evidence to suggest that sort of lifestyle intervention alters the course.
Yeah. If we were to focus on the thyroid in pregnancy and a phrase I just learned a couple of seconds ago, congenital hypothyroidism.
Wow.
Right? What is that, and what is the link between thyroid health and pregnancy?
So those are kind of two different things, but congenital hypothyroidism are young children born actually usually without a thyroid. And that is really an emergency because thyroid hormone is absolutely vital for organ development, brain development, all of those kinds of things. So they need to be identified at birth and start on an appropriate replacement. And will be on replacement therapy lifelong. But the link with pregnancy is really quite important, especially in women who are known to have hypothyroidism, that they go into their pregnancies, even prior to conception, really, really well controlled in terms of their hormone levels.
Yes.
Because the fetus's thyroid takes about 11 to 14 weeks to develop. So in those first 11 weeks, when a lot of women don't actually realize that they might be pregnant, important things of organ development, brain development are taking place. And so the pregnancy would be utterly dependent to make sure that mom's hormones are there in sufficient amounts.
Wow. All right.
We've got a call on the line. Yvonne, good morning. What is your question for Dr. Stevens?
I just want to tell him about my goiter. I'm 70 years old now, and when I was 16, I had an operation. Dr. Henry Dutoy operated on me and took the goiter out and put it into a canned fruit bottle. And I was the first one in South Africa that got the clips and that got an operation on the goiter. And I've taken my medicine. I'm healthy. I've lived healthy. I've done exercises up to the age of 60, and I'm still going strong. I'm 70 now.
That is amazing encouragement. Thank you so much for sharing that with us, Yvonne. So words of encouragement that it is indeed possible, like you said, if you take your medication properly, to carry on living a normal and healthy lifestyle.
And I think that's such an important mindset because there's a big movement at the moment towards people saying, I really don't want thyroid surgery. And we do it very little these days in comparison to probably when our caller, had her thyroid surgery because we've got other ways of treating it. But when it's necessary, the outcomes can still be very, very good.
Yeah. I wanted to ask, would there be any value in government maybe changing policy to make it possible for people to get tested on a more regular basis?
So the difficulty is that there's no good sort of evidence to support screening. There's sort of some controversy in medical literature about whether or not there should be universal screening sort of for pregnant women.
Yes.
But even in places like America, where they've got a lot more health expenditure in terms of money, it's still not advocated because sort of cost analyses show that probably the pickup rate is not significantly higher. So, but it is a contentious issue.
Wow.
I wanted to have some parting words from the doctor. Do you have any parting words regarding what we were talking about today?
So I think probably one of the most important things is that if you are treated with your thyroid hormone, because this is something I see day to day in clinical practice, is that people forget to take medication. And I mean, I'm guilty of that. I've probably never completed a course of antibiotics in my life. So I hope
Here you
colleagues
go.
don't
Yeah.
hear that. But it is difficult. So you need to find ways to be able to remain adherent to your treatment,
Yeah.
because then your outcomes are going to be really, really great.
Yeah, sure. So wonderful. I feel like we have definitely been given some valuable insight into our, thyroids and the functioning thereof. Endocrinologist Dr. Zane Stevens joining us from the Cape Institute of Endocrinology. Thank you so much. And of course, we're currently in World Thyroid Week, heading up to World Thyroid Day that's coming up on Friday. Thank you so much.
Thank you.